as India moves to join the 1 million Corona club. Cities and towns and districts are left with no option but to relock. Bengaluru has locked down. Pune has locked down. Parts of Karnataka, Kerala, Uttarakhand, Uttar Pradesh, Assam, Tamil Nadu, West Bengal, Arunachal Pradesh, Maharashtra and Meghalaya have all been locked down again. And now the entire state of Bihar is to go under full lockdown for 14 days. Viral Bihar, where the cases are fast spiraling beyond control.
Hello and welcome to the News Lockdown, the show that brings you the news and the news without the noise and the news beyond the headlines. While coronavirus cases continue to wreak havoc across the country, it's in Bihar now that the situation is really worsening by the day. This is one of the most populous states in the country, which is why the increased caseload in Bihar is becoming such a worry. For 3 days in a row now, the state has reported more than 1,000 cases per day. And remember, this is in a state where testing is very low. What is worrying, in fact, is that because the testing rate in the state is low and the numbers are rising, the situation on the ground could actually be much, much worse. Today on News Unlocked, we turn our attention to a state that perhaps is going to become the biggest corona challenge in the months ahead. Rohit Singh from Patna gets us this first report.
The steadily rising coronavirus tally crossed the 20,000 mark in Bihar today. Under the worsening circumstances and a sudden surge in COVID cases in the last 10 days, almost one-third of the total 38 districts are already under lockdown. But starting July 16th, the entire state will be under a complete lockdown till 31st of July.
हम लोग लगातार जन जागरण के विभिन्न प्रयासों के माध्यम से लोगों में यह संदेश पहुंचाने की लगातार कोशिश कर रहे हैं कि फिजिकल डिस्टेंसिंग बना के रखें और मास्क और गमछे का उपयोग करें, लेकिन कहीं न कहीं उसमें थोड़ी कमी और सावधानी रही, जिसके कारण भी संख्या बढ़ी है.
Patna has been the worst affected with 2,097 cases reported till 13th of July, followed by 1,074 cases in Bhagalpur, 813 in Begusarai, 787 in Muzaffarpur and 711 in Siwan. Out of the 1,020 fresh cases reported today, Patna accounted for the maximum 242 cases.
Right now we are outside the Governor House here in Patna, and there was a sample collection that was done a few days back, and today the report has come according to which more than 3 dozen officials and staff working at the Governor House have been tested positive. And yesterday we saw how BJP was also attacked by the COVID menace. In fact, 75 of their leaders along with other staff working at the state BJP headquarters, they have been tested positive.
Not just that, Patna District SP East as well as SP Rural have also tested positive. At a time when the state is supposed to go to elections in barely 3 months, the opposition has hit the government hard for its failure to contain the spread of the virus.
नीतीश जी नजर नहीं आ रहे. क्यों नहीं नजर आ रहे? क्योंकि क्वारंटाइन हो रखे हैं. क्यों हो रखे हैं? क्योंकि तेजी से संक्रमण फैल रहा है. और जहां मुख्यमंत्री 10 बार चीजों को सैनिटाइज करवाया जाता है मुख्यमंत्री आवास, जब वहां तक ये पहुंच गया तो आप समझ सकते हैं कि आम नागरिकों की क्या स्थिति होगी. तो हम तो चाहते हैं कि लोकतंत्र में जब लोग ही नहीं रहेंगे तो तंत्र का क्या मतलब है? यानी आप बूथ से सीधे आप चले जाओगे शमशान? क्या आप लाशों के ढेर पे चुनाव कराइएगा?
Testing rate in Bihar has been dismally low, probably one of the lowest in the country. Till a month back, on an average, the state was testing just about 1,012 samples every day. With an estimated population of 12.5 crore, Bihar had tested just about 1 lakh samples till about a month back.
तो आज से 4 महीने पहले एक भी जांच यहाँ नहीं होता था, लेकिन लगातार हम लोगों ने अपनी क्षमता को बढ़ाया है। जहां एक भी केंद्र नहीं था, आज 51 केंद्रों पर जांच की जा रही है, और जहां आंकड़ा शून्य था 4 महीना पहले, आज हम 10,000 से भी अधिक सैंपल टेस्ट करने में सफल हुए हैं।
टेस्ट का रफ्तार थोड़ा बढ़ा है, और टेस्टिंग करने से जो है तो केस तो निकलेंगे ही, और केस जब निकल रहे हैं तो सरकार ऊपर प्रेशर है, इसलिए दोबारा लॉकडाउन कर रहा है सरकार।
To speed up testing further, the state government has now authorized the use of rapid antigen kits. Rapid test kits are likely to be available in all the districts within a week's time. But the fear is that it might already be too late to check the surge of coronavirus.
While Bihar attempts to better its testing rate, which is among the lowest in India, the number of cases are expected to go up further in the coming weeks. What is emerging is videos of apathy. The big question is Bihar's health infrastructure really capable of dealing with the crisis? Remember, Bihar's health infrastructure is at the moment under severe strain. Rohit Singh has more.
A sudden spike in COVID cases across the state has left Bihar's medical infrastructure struggling.
ये आपने देखा, ये 2 दिन से बड़ी डेड बॉडी पड़ी हुई है, आप ये देख सकते हैं। देखिए, ये 2 दिन से ये इतना बुरा हाल है कि हम बता नहीं सकते। एक ये बॉडी है, अब ये देख लीजिए, अब ये देख लीजिए, ये देख लीजिए, अब ये सुन कि यहाँ की सिचुएशन क्या खराब है। ये
Shot by a kin of a COVID patient, this video went viral last week. It was claimed that the dead bodies of 2 COVID patients were not even taken out, while other patients continued to be treated in the same ward where these 2 lay waiting for a departure.
प्रॉब्लम यही हुई थी कि सर वो लाश को हटाया नहीं जा रहा था, और इसलिए मैंने वो जो वेट किया जब उसको बदबू आने लगा तो मुझे डेंजर लगा, इसलिए उसको मैंने हटाने के लिए जब बहुत सारा के पास गया तो उन्होंने रिस्पॉन्स नहीं दिया। हाथ भी बहुत सुनता था, इसलिए मैंने मजबूरी में ये वीडियो बनाया।
The video is said to be of Nalanda Medical College and Hospital, one of the designated COVID hospitals in Patna. The hospital administration, however, claimed that it was nothing but a procedural delay.
एक दिन में ही 8 मरीज हम लोग के यहाँ डेथ किए थे। अब उन लोगों का जो भी डिस्पोजल की प्रक्रियाएं हैं ना, वो थोड़ी सी क्लमजी है, क्योंकि कोरोना पॉजिटिव पेशेंट्स हैं। ये प्रोसीड्यूरल डिले इसको कहेंगे या प्रोसीड्यूरल टाइम कहेंगे।
As Bihar deals with an increasing viral load, floods have come as a double whammy for the state. A civil hospital in the town of Ara saw more than 300 COVID samples being submerged in rainwater that flooded the hospital premises. With such incidents of apathy coming to light, the Bihar government has come under the scanner for its handling of the COVID crisis. The state government, in its bid to amp up medical facilities, has directed 6 medical colleges to prepare isolation wards. But experts feel more could have been done.
सरकार मिशनरी को थोड़ा सा ध्यान देने की जरूरत है। डेडिकेटेड कोविड वार्ड बना दे। जो मेडिकल कॉलेज में पेशेंट की संख्या कम है, अब यहाँ पर जननायक कर्पूरी मेडिकल कॉलेज मधेपुरा में उसको डेडिकेटेड कोविड वार्ड बना दे। ये जो है सो पूरे जो है सो सहरसा, मधेपुरा, सुपौल, पूर्णिया, कटिहार, किशनगंज सबको कवर कर लेगा।
The government has also decided to declare Patna AIIMS as a dedicated COVID hospital with 960 isolation beds and 40 with ICU facilities. Until the decision, Bihar had only 3 dedicated COVID hospitals, providing 1,497 beds in total.
इस हालात से जिस तेजी से जो संक्रमितों की संख्या बढ़ रही है, उसमें अभी मौजूदा स्वास्थ्य व्यवस्था जो हम महसूस करते हैं, उस पर बहुत ज़्यादा प्रेशर आने वाला है, और शायद अभी के मौजूदा हालात में स्वास्थ्य व्यवस्था उतनी सुदृढ़ नहीं है। पटना एम्स भी कोविड हॉस्पिटल बना दिया गया है, क्योंकि संक्रमितों की संख्या बेतहाशा बढ़ रही थी, और साथ ही साथ बिहार में ज़्यादा बेड के इंतजाम करने की आवश्यकता होगी।
Heading towards becoming a COVID hotspot, Bihar has the lowest doctor population ratio in the country. According to the National Health Profile 2018, Bihar has just 1 allopathic doctor per 28,000 people approximately, and just 1 hospital bed per 9,000 people approximately. With camera person Deepak Kumar, this is Rohit Singh in Patna for India Today.
And let me go straight across to Dr. Ajay Alok. He's both a doctor as well as a leader in the Janata Dal United, the ruling alliance government in Bihar. I appreciate your joining us, Dr. Ajay Alok. I'm looking at the numbers. Bihar has the lowest COVID-19 testing rate per million among the 19 major states in the country as per data released last week by the Niti Aayog. You are actually almost 15 times less than the tests per million being done in Delhi. Even neighboring Jharkhand is doing almost double the number of tests in Bihar. What is it? Why is Bihar unable to test more for COVID even as the number of cases spike?
Well, Razi, let's start like this. Like 4 months ago, like what you heard the health minister saying, we never had a single test center. With the help of center and with our own resources, today we are running 51 centers. And on a daily basis, we are testing more than 10,000 people per day now. Of course, the testing was not at this pace, say around a month back or so.
No, you're doing
But now we
antigen.
are
You're not doing. You're doing some antigen tests to boost up the numbers. The fact is, your numbers still remain well below the national average.
Well, we are well below the national average. There is no doubt about it. And antigen testing has started only since yesterday. Till now, we have been doing RT-PCR compulsory for everyone, and RT-PCR is being done at approximately 10,000, and we targeted to take it to 20,000 in the next 10 days. That is that by 20th of July. That is the same target what the Chief Minister has said. And we are monitoring everything. Now, let me tell you one thing. Two things is very clear. We are getting a number of cases spike for the last 7 days.
Yes, go ahead.
And the thing is, the number of serious patients is still luckily very low. Asymptomatic patients are much more. Right now, I'm sitting in front of you. I'm COVID infected. I am asymptomatic.
Okay, we'll try and come back to you in a moment because we're having a difficulty with the audio. I want to come back to you because the fact is, and you can see in the graphics, why are we focusing today on Bihar? Remember, Bihar goes in for a massive lockdown again tomorrow. While many other parts of the country have been doing lockdowns in small areas, the entire state of Bihar intends to go for a lockdown from tomorrow. Now, remember, this is also the state that has seen lakhs of migrant workers returning from other states following the countrywide lockdown in March. Over 30 lakh migrants from different parts of the country returned to Bihar over the last couple of months. Many of them were found infected with the virus. Many believe this contributed to the spike in cases. Let's do a status check on the migrants who've returned and tested positive.
Migrant workers. Many of them covered thousands of kilometers on foot. Most hopped onto buses and boarded the Shramik special trains. And around 30 lakh of them finally managed to return to their home state, Bihar. But as they kept pouring in, the impact of those returning to Bihar from red zones like Delhi, Mumbai and Gujarat was huge. The state saw a spike in its caseload. According to the State Health Department's data, by the beginning of June, 75% of migrants who returned home tested positive for coronavirus. 28-year-old Kaushal Shah, along with his family of 11, had reached his home in Begusarai on 15th of May. But 8 of them tested positive for coronavirus and had to be sent to an isolation center.
क्वारंटाइन में तो एक भी मतलब कहीं बढ़िया से खाना पीना नहीं मिलता था, हैं? और दूसरी बात परेशानी ये था कि मतलब कितना भी कोई भी डॉक्टर और सब भी जो रहते हैं ना, कोई परेशानी को समझने का नहीं समझ रहे थे.
Once they recovered and came back to their village, they spent another 14 days under home quarantine. But what hurt them was the stigmatization the family faced once they recovered completely.
मतलब क्वारंटाइन से आए हो, ये है तुम्हारे अंदर अभी भी हो सकता है, थोड़ा दूर हट के रहो.
पॉजिटिव होने की वजह से होता है.
हाँ, अब बहुत परेशानियाँ उठाना पड़ा. कहीं राशन की दुकान में राशन पानी भी ढंग से नहीं लेना सकते थे, किसी के साथ में बैठ उठ नहीं सकते. ऐसा लगता है यहाँ की स्थिति.
Meanwhile, even as the cases in Bihar continue to surge, many migrants have now decided to go back to their places of work.
Dr. Ajay Alok, before anything else, I must ask you how you are keeping, because I'm told you've also tested positive for corona this morning. Is that true?
Well, I tested positive almost a week back. I'm asymptomatic and I'm under home quarantine. Me along with my wife and kids, we are all corona positive and asymptomatic for the last 7 days.
So you're under home quarantine.
So let me tell you.
Yes.
Yeah, I'm on the home quarantine and I'm going to be tested again after 3 days and hopefully it will come out to be negative. Now let me tell you, Bihar, by the virtue of God's grace or whatever, the number of the cases, the serious cases, what we are talking of hospital beds or ICU, that requirement is still very low. We are having adequate number of ICU beds. We have already prepared the isolation coaches. We are trying to increase the number in every bed. But of course, the spike is very high and we are just praying that the deterioration is not there. What we are seeing, this is a good positive sign for us.
But
of course, we are trying in every possible manner.
Dr. Ajay Alok, you might remember in the last week, several videos have also come out which have gone viral where people have complained about the quality of health facilities and infrastructure at the moment in some of the COVID designated hospitals in Bihar. Is that a function of the fact that Bihar's general health infrastructure needs to be stepped up?
See, number one, in Bihar, none of the private setup have the facility to treat the COVID patient. Now the IMA has demanded from the government that certain private hospitals should be granted permission to treat COVID patient. Second problem being, as a doctor, I can tell you, and very honest confession I'm giving you, this is about not only Bihar, but about the whole country. That if you are COVID positive and if you are in a hospital, what you are met with is a very optimal treatment. This is the fact. But that doesn't mean that the doctors are not doing their duty. They are working more than their shift. They are working 16 hours a day, as far as I know, in Bihar, just to serve the patient and to the fullest of their capacity. Now, this kind of procedural delay, what the video was showing, that there's some body lifting and it took some long time, that's definitely a procedural delay. But yes, the kind of infrastructure we have, what we have created, and with the kind of infrastructure what we are delivering to the patient, I think nothing can be sufficient, but yes, we are trying the level best, whatever we can. And the doctors are doing overwhelming a very good job.
Just play that video, because this video went viral. I just want you to listen in, Dr. Alok.
ये देख सकते हैं, देखिए ये आपने देखा, ये 2 दिन से डेड बॉडी पड़ी हुई है. आप ये देख सकते हैं, देखिए ये 2 दिन से ये इतना बुरा हाल है कि हम बता नहीं सकते. एक ये बॉडी है. अब ये देख लीजिए, अब ये देख लीजिए, ये देख लीजिए. अब ये सुनिए कि यहाँ की सिचुएशन क्या खराब है. ये बिल्कुल ठीक है, ये ठीक होकर जा सकते हैं, पर ये कंडीशन इतना सिचुएशन खराब करके यहाँ पे रखा गया है कि कोई भी इंसान आए तो डर के मारे अपना क्षमता खो सकता है या कुछ भी उसको हो सकता है. कुछ साफ सफाई ये आप ये देख सकते हैं. ये देखिए, ये यहाँ का आईसीयू देख लीजिए, देखिए.
Presumably, Dr. Ajay Alok, you're telling me these are isolated cases. These are exaggerated. These are designed to spread fear. Am I correct?
No, I'm not saying these are exaggerated cases. This could be a truth. And this has come in our knowledge and explanation was sought from the superintendent, and what he said that it was a procedural delay. But the strict warning has been issued that these kind of things must not happen. And if you remember, as these things used to happen in Mumbai too. We have seen Mumbai hospitals also having the similar number of problems. See,
no, the worry, I concede, but the worry is, given Bihar's large population, large number of people who live below the poverty line, given the fact that Bihar's health infrastructure may not be as robust as that of Maharashtra, if the cases continue to spike, the worry is, will Bihar be able to handle that kind of spike?
Well, by the grace of God, till now we are handling it nicely, and we hope that will contain it. And that's why we have imposed the lockdown, so that we can contain at least
Let me bring in Dr. John Mukhopadhyay. He runs one of the best hospitals there in Patna. Dr. Mukhopadhyay, are you confident that Bihar can handle this spike in cases? Is this going to be the next big corona hotspot?
Good evening, Rajdeep. Firstly, I don't run a hospital. I am an orthopedic surgeon.
You're an orthopedic surgeon.
I'm the director of the orthopedic department in Paris Hospital in Patna. So I don't run the hospital. So let's first get that clear. So I think what's happened in Bihar, and unfortunately, this is a situation which is now happening in a lot of the non-metropolitan cities in India, is that although we did not have a large number of cases initially, now suddenly there's a rapid increase in the number of cases. Okay, and having said that, we really have the infrastructure to deal with the number of cases that we have at the moment and are likely to get in the future. Okay, so that is the most important issue at the moment. Not just infrastructure, but also people capable of dealing with these patients, because it's not that they are like any other patient with a cold or cough. A lot of them need treatment in the ICU. Some of them will need ventilation. And we really need to have enough trained people, not just doctors, the intensivists, but also nurses and paramedical staff who can really deal with this
so
kind of
do you have
problem.
enough? Do you believe Bihar has enough, particularly as you go beyond Patna? Will it become even more difficult?
I think if the numbers rise significantly, it will become difficult. I think it is already becoming difficult even in Patna. Now, I'm not directly involved with dealing with these cases, so I'm not privy to the exact numbers of patients admitted in various hospitals. But as of now, as far as we know, there are only 2 hospitals, that is All India Institute and Nalanda Medical College Hospital, which are admitting COVID positive patients. Okay, there are some other hospitals which do have the facilities. I'm sure the government is looking at steps to include them. But as of now, these, as far as I'm aware, these are the only 2 hospitals which are dealing with them, and I believe they are beginning to struggle with the numbers.
Let me ask you that, Dr. Ajay Alok, are you going to need many more COVID-specific hospitals now in Bihar in the weeks ahead?
Yes, definitely. It's on the cards, and we have already started designating them as a only COVID hospital, like in many districts, like in Bhagalpur, like in Pavapuri, other odd places. And also the government is thinking in terms of involving private sectors now, so that we can ask every private hospital to reserve their beds, a certain number of percentage of the beds, maybe 30% or 40%. Because what we are anticipating right now, and plus there is a new ICMR guidelines also, like patient like me, who's infected but asymptomatic, they should be in home quarantine. And with mild symptoms, they can also be under home quarantine under medical supervision. So all these measures are being taken, and we are looking at every front, and the government is dealing very proactively with it. But yes, with the soaring population we have around of 13 crores, we can just keep our fingers crossed that the infection should not spread. We can contain the infection as much as we can.
Can I therefore ask you an honest question in conclusion, Dr. Alok? Was it because of the coming elections that take place towards the end of the year in your state that you were unwilling to test more? Because you feared that the numbers would rise. Bihar wants to keep the numbers artificially down, because if your numbers rise, it's bad news for the government.
Well, it's not at all. If number is not at all in the government's hands. Secondly, if that was the case, why would we be testing 10,000, and why we would have set the target of 20,000 by 20th June? So that is not the question. Secondly, election is not in the hands of Nitish Kumar or for so-called Mr. Tejasvi Yadav. It's in the hands of Election Commission, who will decide in the month of September, not now.
Okay.
So right now, the time is not about elections. Those who are creeping about election, let them creep about elections. We are concerned more about how to tackle COVID and how to control it.
Okay, let's leave it there.
Primary focus.
This is the big challenge. Bihar is the focus. A number of people have been writing to us, in fact, saying you'll focus on the big cities. You're not telling us what's happening in states like Bihar. Well, we've tried to shed some light. I hope you realize what's happening and the big challenges on the ground. Dr. Mukhopadhyay, sorry that we couldn't connect with you earlier. Dr. Ajay Alok, thank you for joining us. That's it on the News Unlocked, news without the noise. Thanks for watching. Bye for now.
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.